Ricky, I like those glasses.
You're my same glasses.
I know, but I just love them every time I see them. It's like it throws me back to the 80s and like jelly shoes and like Cazelle, and
Yeah.
it feels very 80s.
Hey Mo,
Hey, Ricky.
the doctor is in.
Yes, we are. And it is a beautiful, beautiful Wednesday
It
and always
is.
a good time to talk about,
It
you
is.
know, the things that face our cancer patients and our blesties the most. You know, when you get diagnosed, you're thinking about, okay, am I going to die? Do I need chemo? What am I
Right.
going to do about my kids, my vacation, and what about my money? Right? What about all of the other stuff? You're
Everything.
probably not
My
thinking about
life.
yourself.
Right.
Right.
And
Right. And putting
so
everybody
many times,
first.
yeah, so many times people call us and and we have to triage their life before we can even talk about cancer. Like, when was your last meal? Where are your kids? Where do you sleep tonight? All those things. But
Mhm.
we have a solution with us
I love
today.
that.
Or
That's what
many,
it's about.
many, many solutions today, the Ellie Fund. And so I'm not even sure how we met you guys. Did you call us?
Yeah, we stalked you pretty
Yeah.
much.
Yeah. Nikki gets
So,
that a lot. She's very stalkable.
yeah, so introduce yourselves, you guys, and then we're going to talk about what these amazing women do in the
Mm.
Boston area, really in Massachusetts, and how they're helping so many women and are really like a model for how what we should have everywhere,
I
and
love that.
they're just like saints from heaven. So introduce yourself. Who wants to go first?
I'll go first. Nakia Clark. I am the Director of Community Engagement here at the Ellie Fund, and I will pass it to Donna.
Hi, everybody. Donna Remen, Director of Strategic Initiatives at the Ellie Fund. I personally have been at the organization 6 years and did Director of Development work for the first 5 years, and was so moved by the programs that Ricky was talking about that I had to put fundraising aside and move in, join forces with Nakia and build the programs that we're working on, which she'll talk about.
Cool, 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 cool.
So
Well,
what is the Ellie Fund? What's the
yeah,
history on it?
yeah, start with ground zero. Take us all the way down.
Yes. Okay. So we're in our 30th year of inception. Ellie is named after our organization's mother. Her name was Eleanor Pumpkin, and she had metastatic breast cancer in the 80s, when at that time it was unheard of to live as long as she did. She lived 15 years with it. And
Wow.
she was always caring, always giving back. And the support that her sons received during her treatment is what brought them to, after she had passed away, to want to give back to others. So it started off with meal delivery, and then it's warped into, we have several services that we offer to anyone who is going through breast cancer. They either have to live or be treated in Massachusetts. So if you are out of state, but you come into Massachusetts for treatment, we're still here and able to help you and assist.
That's
That's great.
incredible.
That's great. So if you go to Dana-Farber to do a clinical trial or something, people can get your help.
Yes.
Totally.
Great.
And there is no income barrier, there's no barrier of any kind. So truly, exactly, there's no screening of any kind. In our mission, we're able to support every single person who's being treated in Massachusetts for at least one service grant, which can last up to 6 months. And Nikhil will go into the details about that. But and then if a patient's going on clinical trials, for example, we can serve that patient again for another 6 months or 3 months, depending on their diagnosis. And if there's a different kind of diagnosis, we can serve those patients again. So we really are trying our best to reach every single person and give hope to each and every individual that is navigating this disease, and prop them up at the beginning of treatment. And then we're so well connected in the state that we can, push them out into the community when our financial grant ends, but we still stick with them for love and warmth and support and education and events, and cheerleading and everything we can possibly do, in the non-financial side of things.
That's incredible.
Wow.
Wow. And, I have to ask my famous question now. What's your why? Why do you do this, Dana? And Nakia, why do you do this?
So
Oh my
there's
God.
two reasons why I do it. I am a breast cancer survivor of 7 years, And when I was diagnosed with breast cancer, my mom was going through metastatic breast cancer. So at the time, I knew of the Ellie Fund when I was diagnosed. It was not given to me at the doctors. They didn't tell me about the Ellie Fund, but because I knew of the Ellie Fund and the support that was received by my mother, I knew I had to jump on and ask for services. And particularly at the time, not only was I caring for my mother, but I had a toddler still in daycare. So I was contemplating whether or not to keep him home with me while I recover, or eat those costs of daycare, knowing that my income was going to be reduced due to me being out on leave. And you don't really, you ask for what you're looking for, but you don't really know what you're going to receive. And so when I received the letter from the Ellie Fund saying that I was going to get childcare paid for, as well as groceries for the family, that really took that burden off. And so my why is I want to give back. My mom has since passed away in 2020 from breast cancer. And so I wanted to give back. And I started off with volunteering because I was so grateful for what the Ellie Fund had done for me. It's a local organization. They really care. I mean, they check on you. And so I give that back. To what I received is what I give back to the patients that come to us on a monthly basis.
Wow. 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 How much is the grant? I mean, let you guys get, does it depend on the person, or how do you guys decide how much to give, you know, because people come and asking for help all the time. And
Yes, yes. So we have a cap of $350 each month, depending on diagnosis.
wow,
So they would either receive it for three
wow,
months if they're a stage 0 to 3, or 6 months if they're a metastatic patient. So it's in the form of a Visa card, and that allows the patient to go
wow,
to whatever gas station they typically go to
wow,
whatever
wow,
grocery
wow,
store they typically
Exactly.
would go to, and pay for the things that it makes them empowered to pay for things. And sometimes you may not have a ride to get to your treatments, but you have a neighbor or friend or family, and it's nice that you can say, I'll pay for the gas with this Visa card. And if there isn't anyone that can bring them to the doctor, or they can't go themselves, we do provide cards for Uber or Lyft so that they can get to and from treatment.
And you know
Isn't
what
that
that's called,
amazing?
Nakia? Agency, right? Because you don't feel like charity care, but you actually have control over the things that you need to do and the
Yes,
ways in which you need to
Right, right,
spend your finances, where you direct your dollars,
right.
and how you can navigate that system to feel more empowered. I love that.
It was super
yes,
recent. I mean, it was like within the last 2 years, and we're a 30-year-old organization, and just within the last couple years, we were giving gift cards to the grocery store of the patient's choice, and it's great, but it's limiting, and sometimes
yes,
people don't, there's just we really felt strongly that we had to move to a place of dignity to let people decide. All of that said, people can also choose that they need, a partial reimbursement for childcare. We can directly pay for that, or they need housekeeping. We can directly pay for that too. Alternative therapies like Reiki, oncology, massage. We'll pay those for those directly, or if they prefer their own provider, we'll give them the money to pay for it. So
Wow.
we're like super trying to meet patients where they are. And frankly, if the list of things that we kind of say we give and support isn't what they need, maybe they need a dog walker because their companion, we've seen this, is their
hmm
pet, and they won't leave that pet for
Right?
treatment. And we'll pay for the dog walker. Like, so we really,
yes,
or a wig, a culturally appropriate wig. Some people won't get
Mhm.
chemotherapy because if they lose their hair and
Yeah,
they don't have hair, they don't
right,
want that,
right, right,
you
right.
know?
yes,
My God.
So
Well,
we
I
will
had a
work with
patient who,
patients. What?
I think
wow.
a lot of what you guys do too requires trust. So I think a lot of the time we'll recommend that people go, some of the sources that we have, but they won't pay the money to the patient. They'll pay the money to the electric company or whatever, because they really just don't trust the patient. You know what I mean? I think they don't give credit to the patient and what they need. And so the programs, though very helpful and generous, are very prescriptive and
hmm
kind of keep the power away from the patient. And that's what I love about you guys, is that you give them power back, because everything
yes,
cancer, and you know this,
Right.
Nikki,
And at
everything.
least have the option.
Yeah, it
right?
takes,
Like if
yeah,
you
it takes
can't
your
pay your
power
bills
away.
and you can't open the mail and go through it, great. If you can get, somebody to
Right.
do it, that's wonderful. But that should be your choice. You're right,
It should be
Vicky.
your choice. Yeah, that everything about cancer takes your power away. You feel powerless. And so, especially when you start thinking, making decisions about, do I feed my kid or buy my medicine? Or do I
Right.
take my kid to school or go to chemo? Because I only have, one car ride or whatever. So this just enables people to feel power again. Like I'm in control of something in my life.
Yes.
And that's such a blessing. Such a blessing.
So
Do you see the white behind them both? You see those wings that are starting to like come out of
I
back
know.
here?
You know,
I don't
there's
know if
like a
anybody can see
halo.
my
You see the halo over their heads, right?
it's the least we all, that we all should be doing for our people, and wrapping services around our people. We just got back from a health equity summit today. I was talking to Ricky about it earlier. And one thing that the Ellie Fund is doing that we're telling everybody at this big, beautiful 500-person event is that we're working with local community health centers to not like there are a lot of people who won't say yes to services because of dignity issues like we were talking about, or privacy or fear or shame or all these reasons. And so, believe it or not, you think that it's
Yeah,
like this, everyone will take this gift, but people don't. And so what we're doing is we're implementing for the very first time. No, but everyone's excited about it. It's not done anywhere. Automatic referral to the Ellie Fund for every single breast cancer patient that's in the walls of this health center. We're piloting it out at a health center that has like 7 or 8 buildings in Boston, and they have a few hundred patients, breast cancer patients,
A
Nikki,
year.
a year.
Yes.
We serve maybe a couple of dozen from this particular organization, but we want 100%. We're not going to get 100% until every single person is automatically referred
right,
so that they can opt out. If they don't want it,
right,
they
right.
can say no, but the
But at least
doctor
they have the
say
opportunity,
they
right?
have
And they know
Exactly.
about you, and they know about
Yes.
yeah,
they
the
know
doctor
about
would say, here's your treatment plan, and here is a
us.
Visa card to help you get here. Make sure you come. Here you can pay for your kids' childcare, whatever it is. So we're gonna update you on how that goes, but that's something that we're piloting right now.
I love that you're looking at this through the lens of equity as well, because in Boston in particular, something like 60 to 75% of Black and brown cancer patients go to the community cancer centers because they feel
Yeah,
seen, because there's a more diversity, because they're in their neighborhoods, right?
right.
And they may not go to the NCI
Dana-Farber,
designated
Harvard.
major
Yeah,
cancer,
right,
right? They're not going to Harvard and MGH and Dana-Farber necessarily.
right,
And so if you target those as your core demographic, you're going to maybe exacerbate disparity. And so I
Yes.
think it's really
right.
powerful that you're looking at this through the lens of the community. And Dana, you didn't tell us your why,
Oh
but
yeah.
you're up.
Yeah. Wait, I have to finish your thought. I have to finish your thought, and I think I forgot what I was going to say. Oh, primary care, right?
Community.
Addressing it in primary care, addressing it before the shit hits, excuse me,
Yeah, the shit hits the fan. You can say shit, I
before
say it
the
all
shit
the time.
hits the
Yeah.
fan. Okay,
Um,
so that's my why. I
that's our motto, get shit done.
got shit done,
There
right?
it is. This
Oh
is
my
my
Yeah,
God.
touch note.
it's over there. I
Yes.
see. It's right there.
Yep,
The
the back
scarf.
of it.
Get shit
There
done
it
and
is.
That's funny.
do iconic shit. Those are the hashtags.
Okay. So I've been freed of shame
You've
and blame.
been freed of it. Okay.
Yeah.
We
Yeah.
try not to say other words, but sometimes the frogs slip out.
Right.
Yes.
Right.
When you're
Okay.
passionate about something. Yes.
Yeah.
Exactly. I think my why is well, Nakia is my why, and the beautiful women that we serve at the Ellie Fund and the women that we don't serve yet are my why. And creating a health system that gives everyone their dignified right to have the same outcome, the same chance at the best possible health outcome. And when we sit here in a place like Boston, where where the healthcare is like, healthcare mecca, and we showed up on a list in Boston of the top 50 cities that had the biggest black-white disparity in breast
Yeah.
cancer mortality not too long ago, like 10 years
Right.
ago. Those
Yeah.
are healthcare systems and models that am passionate to fix. And that is my why. And Ellie Fund has really, we are just moving so fast and moving so hard, and really out there making that happen.
Awesome. Awesome. Do you have navigators? Like, who actually interacts with the patients? So if the doctor refers the patient, like, what's the process? What happens?
Yes, so we get the information and we process the application. So we have a group called Patient Services that handles all the incoming
So
applications.
the doctor sends you the information or the patient?
Both, actually. So a
Okay.
patient can refer themselves, or
Okay.
a doctor or someone at the
Okay.
hospital.
Right.
It doesn't even
Right.
have to be a doctor. It could be anyone at the hospital or
Right.
the
Any,
patient.
okay.
So once we get that information, they receive a pop-up that says, we received it and we processed it. And we have that team of patient services consisting of two, going on three. I used to oversee that program, but now I'm into outreach. But they talk to each and every patient. We see about 120 patients each month, and
Wow.
probably half of those are we physically talk to the patients.
Wow. 120 each month.
We
Isn't that
take on about 120, 125 new patients a month, and at any given moment, we have about 400 to 500 active patients. And that team is just endlessly, we said to ourselves, if we grow and and we're there for all 7,000 newly diagnosed breast cancer patients in mass every year, we're not letting go of that personal touch. We
Right.
will go as fast as we can. We'll add as much as we can to the patient
wow.
services team.
Wow.
But that is what people write to us saying meant to them the most, was the
Yeah.
love and the
Wow.
personal attention.
Hmm.
Wow. 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 Wow.
And it doesn't stop with those services. We also have a support group, one for metastatic and one for curative patients that meet on once a month, on the second Tuesdays and Thursdays of the month. So they can join the group at any time to get that support from their peers. We also, as we
That
mentioned, we
virtual? Is
talk
that
to
virtual or
virtual. Yes,
okay?
yes. And we talk to patients, and sometimes their stories are tough. And what we do, we have an anonymous donor who donates for us to send flowers. So if we talk to a patient and we hear
Wow.
what's going on and we like, you know what, they could use some flowers, we'll send flowers to them. So we're always staying connected with the patient even after their grant is over.
Wow. 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 So how do you guys get the money?
Donna, you're up.
It's so hard. It's so hard.
And
Of
how
course
do you
they know Donna,
replenish the
yeah.
money, right? Because you can get it
Yeah.
once, but how do you keep this going so that you can help
120
more
patients a
people?
month times all that money. Like that's a lot of money.
So
Yes.
so in 2019 our budget was $1.25 million, let's say, and now we're over 4 million. So just in that short time we've, and it's all through philanthropy. Except the last 2 years we had support from the state of Massachusetts to do the work I was talking about earlier about
Yeah.
integrating with community health centers. So they give us a good chunk of support to move ourselves upstream and intervene earlier. We have big events that our red carpet gala, our signature gala on Oscar night every year for the last 30 years. Our 30th is coming up on March 15th. That is a big source of funding. We have the, marathon. We have almost 100 runners that run, or well, 100 Team Ellie members a year that run for the marathon, Falmouth Road Race, Ride for Food, Battle Green Run. They all are part of Team Ellie, and they raise money for us. Um,
Wow. That's
Breast
awesome.
Cancer
You
Awareness
have to
Month.
teach us how to do a fundraiser.
What's that?
Well, I was
Yeah.
gonna say
I
Donna's selling
heard you,
herself
Donna.
short because
Yes, you
Donna does
do.
amazing work with grants when she was director of development and we received a lot of grants thanks to Donna. So don't sell yourself short, Donna.
No, I never. But you know what? Ricky knows the pharma world. A few years ago, we said, "Oh my God!" Like we were just discovering the pharma world, and we said, "You know what? We're bringing patients to the
Yeah,
medications. We're bringing Black and brown patients to the
right,
medications."
right, right.
And the pharmaceutical companies have been so wonderful and have
Yeah,
been, I mean, really supportive over the last few years. So,
yeah.
everything, we're extremely diversified and everything's going up. And we believe that when we turn auto referral on, and we will never put patients on a wait list. We've never asked patients to wait on a wait list ever before. We know if the demand is there, we'll raise the money. So it's daunting, but that's what we're up against.
But that's what we're supposed to do. This is your
Exactly.
God job. This is your God job, Nakia. And you're
And
so
Ricky's
blessed
been
to be able to, you
You've
know.
been so generous to introduce us around and make connections, and there is so much collaborative. I mean, it doesn't matter that you guys are in the DC, Maryland area, and we're in Massachusetts. We're all doing the very similar work,
Right.
supporting each other, and I can't thank you enough for the introductions and connections you've made for us.
No, we're all in this together. No one fights alone. I always
Oh.
say that
Can
we
I
need
ask
to be
you?
in the sandbox.
So Ellie works for Massachusetts. Are there similar models in other states? Is there a plan to go
Mm.
nationally? Is there yeah, I think those are my first questions. I have more, but let's start with that. Beyond Massachusetts, or where do you as the leadership, where do you see this going?
Right. So I know a couple of years ago, there was a grant through NIH to start a pilot in North Carolina to do the services that we do. We unfortunately didn't get the grant, so we weren't able to have a pilot with the hospital in North Carolina. But we're always looking to expand and get people on board. And right now, we collaborate with different organizations that are nationally like Touch and other organizations. But I would love to be able to put this model in another state because we know it works.
So
We know.
a little bit more on that. Thank you. Just wanted to emphasize that the NIH grant was written by a primary investigator from Dana-Farber, or a team of oncology investigators. So this is super collaborative. They applied at least twice. And it's crazy that such an amazing
Yeah.
project wasn't funded. Now it's probably nothing of its nature is going to get funded for the next 4 years or 3.5 years. But that's the goal, is to do this collaborative, where you're doing they would have a piece of that pilot here in Boston, some of it in North Carolina, maybe some of it at MD Anderson, so and Meredith, our executive director, has spoken on panels at MD Anderson. One of our doctors left for UCLA. So we have these pockets everywhere, and we're getting geared up to introduce. They're all excited about it. Introduce this model where we have connections around the state, around the country.
And we need that because
Mm-hmm.
it doesn't exist anywhere. And you know what I mean? Like everybody puts like a blip on it. If anything, maybe at patient advocacy, patientadvocate.org, they'll help you for a while, but nothing, I don't think, this consistent. And,
Right.
and I think what's happening too, like Komen gives $800. That's gone in a heartbeat if you have childcare or a kid or transportation issues, whatever, right? And then that's all there is. I think Sisters Network gives a couple $100 or $300 something, but it's all like for the moment. And these women, especially, I mean, treatment takes a year now, right? If you think
Right.
about for early stage breast cancer, you're in treatment for a year before they say you have no evidence of disease. If you're blessed to even have that. If you're metastatic, it doesn't stop.
Right.
You're always going to be in treatment for the rest of your life. So how do you deal? How do you cope? How do you do it?
That's a
Because at
good
some point,
question.
you're not going to be able to work. Or at some point,
Mhm.
you're going to have to choose not to work, right? So
Right.
how do you take care of yourself unless you're independent with it? So this is like invaluable. Invaluable.
Mhm.
I have a question for you. If you like looking at our model, if you okay, so funding isn't infinite.
Right.
If you had the choice between giving more per month and serving less people,
Mhm.
which direction would you go in? You know, so we had at some point we had to
Mhm.
make the very tough choice. Years ago, we had no cap.
Yeah. Yeah.
You know, and when people had large, we did everything by family size, and you know, like we
Yeah.
just didn't have to, you know, and then funds got tighter, and we had to say, well, what's our goal here? Like, do we, you
What
know,
are we trying to do?
is our yeah, are
Mhm.
we spreading hope? Are we kind of
Right.
trying to prop people up right at the beginning and make sure they get a mindset of treatment, early treatment, consistent treatment, and then we know that we can connect them after, you know, to other resources? Or do you think it's better to stay with patients longer and just serve fewer? I'm just curious what you think. Objectively, it would be such a helpful thing to hear.
It's like Sophie's Choice.
I know, I know.
You ever watch Sophie's Choice? One of my favorite movies.
I'm gonna watch it tonight, actually, now that you mention it.
My favorite one of my favorite. I love Meryl Streep.
Yeah.
But it is Sophie's Choice. Like, how do
You
you say,
make this choice every day, Ricky. You know, how do you help more people, or do
I
you give
don't,
fewer
you
people
know what?
more resources?
I don't know. I pray about it every day because no is never the answer. It's always how.
Mhm.
And now I have you guys. So when people from your area call me, I'm going to call you. You know what I mean?
That
You find
And
bits of you which don't really exist in other places, but we kind of milk out all the sources between Molly's, the Pink Fund, and
fun.
and
Yeah.
Shanta's the patient advocate org, .org, and so we send people to Coleman, but basically it's like by any means necessary, can we get you some help? So I don't know what the answer is. I think that we all just have to take whatever resources we have and use them to the best that we can. And we have new customers in our business every day.
Yeah.
Every day. How many women got that my chart today that said, yes, you do have breast cancer? So I don't know how to tell somebody, no, we can't help you. You know what I mean? And there have been times when, we didn't have the ability to help them. We didn't have money. I mean, we don't give money. That's not our purpose. You know what I mean? We try to refer people, but we try to have like our little sort of emergency slush fund when somebody's in a crisis. But it's really hard. It's
Right.
really
'Cause somebody's always in a crisis, you
it's
know,
and
especially
we're
today.
always looking for something that we don't have. And our focus is really to get women the best treatment that they can. Like,
Mhm.
what do you need to get how are we going to make your treatment happen? How are we going to get rid of the cancer? How are we going to, minimize your cancer risk? And so along with that comes, I got someplace to live. I got to feed my kids. I got to get around. So
And then just
I, I
mental health, you know, the
I don't, yeah,
fears and
yeah, I don't know what the
mental
right answer is.
paralysis, emotional paralysis.
Yeah, yeah. And I don't know what the right answer to that is, Dan. I mean, I think it's, you know, but I think it's also what you said too, is like talking to them on the phone and giving them love and just talking to them on the phone and hearing them out, hearing their story, and then saying, okay, you know what? I'm gonna like break the bank here and give you everything I have. Or you know what? Maybe you can hold on a little bit. Maybe I can give you a little bit less than others may need because you're gonna be okay. I think in sort of making those decisions, which I think you guys probably make every day, to say, what do you need this patient in the moment today to get through today or the next month or the next 6 months or to get through your treatment, and
I
trying
think
to
that
assess the situation.
I think that's a really savvy thing to assess because as you look at, it's not a bottomless bucket, but where is the need the greatest? And then so looking at the people you served over the last 30 years and the trends, right? Where's that need the greatest? And then how can you perhaps garner resources and support to address that need from a more systemic standpoint. So if it's a workplace and a benefits issue, for example, okay, so what do people need? How can we help them to leverage their benefits in ways that, are there dollars they can access through their employer? You know what I mean? And so
Yeah.
it might be sort of thinking outside of the box a little bit to get people more from the places that where they already exist,
Right.
but then also maybe some type of like matching sort of slush fund, like the emergency piggy bank. Maybe there's a couple different groups that put into that emergency pot and then they can all kind of draw from it. I don't know if that creates more challenges or not. But some kind of way to
Yeah.
leverage your networks. But also again, looking like Rick, that emergent need is maybe the thing you feel the most, not the recurring need, but maybe it's this, we can do 3 of these payments, but then beyond that, we need to figure out a system to help you accomplish XYZ. And then there's another network, another version of you that's just
Right.
connected to helping fill out paperwork and apply for grants and look at, ways to get childcare or whatever the thing
Right.
is. And that's all they do is to help people get that resource. And that network could then, and I don't know if it exists because I mean, think about it. Our hospitals have like 1 or 2 social workers, period, for
Right.
everything, for every disease.
Everything for every disease, all the cancer, everything.
It's so right. It's demoralizing, to be a social worker and to know how many people need your help and how many people you can actually help in a day. It's frustrating.
Totally. And that's why we want to rethink social work, and just like not think of it as a parallel offering downstream, and to think of it differently and say that social work is not meant to do what we're trying to do. It's not meant to
Right.
capture everybody.
That's
It's not
cool.
meant to, yeah, it's not meant to like take people and capture them right away and move them here, like it's very different. And so that's been very tough is, we never want to say, I mean, we built ourselves from social work, that's who we are. That's how we got here, is on the backs of social workers for 25 years before the pandemic, when we realized, you know what, it's sitting all on them. This can't be right.
Right.
We have to
Right.
put some sweat
Right.
into this and take the onus and just like pull people in and wrap around them. It can't just be the social workers teeing people, like feeding them to us. So that's been a big realization. We kind of had to study ourselves hard to get to that point.
Wow.
But Dan, to answer your question earlier, my gut tells me serve more people.
Yeah.
If just right, the more people, because
Mhm.
there's so many people, right? And maybe we make decisions about what somebody needs over another, which is really hard because what do we know? I mean, you try to assess the situation, but it's like, I just don't know
That's
how.
how the funding works though, too, though, Ricky, right? It's all about
Right.
the impact and the reach, and it's the numbers. So it's a
The
numbers
numbers,
game.
yeah, like what can you do with what? And knowing that tomorrow you're gonna get 3 more calls towards that 120 or whatever the number is, you're gonna get that call. And they're gonna need you. They're gonna need something. They're gonna need money. They're gonna need childcare. They're gonna need food. They're gonna need all the things.
Right.
And but most of all, they need the love and the emotional support. So maybe that's where you start. And then you say, okay, let me see how strong you are or where your weaknesses are. And then we can say, okay, what's the plan for you based on where you are, based in your head and your heart, you know?
Mhm.
And like maybe sometimes the best thing you could do for them is give them transportation to a mental health professional.
That is true.
Right?
Yeah. And
So
maybe some groups would be willing to be a bit of a second line defense, right?
Yeah.
Like maybe you're not the primary clutch one, but after they've exhausted those first round of resources, become
Right.
second round of whatever, and that could be
Right.
appealing to an organization or to a set of, again, matching donors, things like that. And like if they make it this far and they're going on their journey, help them get the next mile,
Mhm.
And so
totally.
finding people who are willing to do that next thing might be a thing. The sort of next mile campaign or something.
Yeah. Well, Nakia, you said that what was most helpful to you, right? Like what
Yes.
refund did to you, like Did you ask for what you needed, or did they tell you what they would offer? Like, how did that conversation happen that got you what you needed for your baby, you know?
There was a list of what you would like to receive, and I picked childcare and grocery.
So you had,
Hmm
which is great
I
because you
chose,
hours
yes.
too. Yeah.
And we still have patients choose what they would like the funds to go towards.
So think about it. Could you have chosen more than two things?
Oh, definitely.
All right. So
I
basically
could have, yes, but those
yeah.
were the key things that I felt I
So,
needed.
well, but you were respectful about what you needed. Do you know what I mean? Like you
Hmm
could have said, I want everything, right? And so, you know, so and I'm sure there's a balance in what you get from patients, but I think that giving people a choice is just so empowering and like respectful. Instead
Yes,
of
it
saying,
is.
here's the gift card, just assuming they need gas, or here's the Uber thing, just assuming, right? But you're saying, I need childcare. I need this today to make my life easier, right? I was once on this panel at SABCS. It was actually Mammoth's first event down there, Mo. And I was on this panel, and I was sitting there with this very, very beautiful, well-to-do white oncologist. She had her beautiful St. John suit on and her beautiful Italian shoes and all the things and her Gucci purse and all the stuff. And she was saying how, you know, we have gift cards in our office. We give grocery cards. We give Uber cards. We give all the things. And I said, well, okay, well, how does a patient know about it? And she said, I don't know. Somebody in my office must give them to them. And I said, well, how many have you given out in the past month or so? Like, what are you giving out and where do you get them? Like, I don't know, because I don't handle it. I'm the doctor. I'm like, okay, well, how does this whole thing work? Well, all they have to do is ask for it.
Not happening.
That's
Yeah.
the thing. Yeah, that's
Yeah,
the thing.
I said, they're not going to ask. Oh, I'm a poor Black mom, single.
Hmm
Mom. Can I please have a Whole Foods gift card? Not going to happen.
Right.
She got so mad, she got up and walked off the panel.
And it's always in the last 5 minutes of the visit. You know, I have patients, one of elderly woman in particular, I can recall, and we talked about everything. We went through our plan, and finally I said, okay, talk to me about your diet. You know, are you losing weight? Like what's a typical meal like for you? You know, what's a typical day's worth of food like for you? And
Yeah.
her daughter said, tell her, mom, go ahead, tell her. And she said, well, you know, food's really expensive, so I go to the soup kitchen, and you know, sometimes it's good and sometimes it's not, and I'll get something at lunch and I'll just split it and stretch it for dinner. And she's lost like 30 pounds, but it was the last 5 minutes of that visit. If I hadn't asked that question, I would have walked right out that door and she wouldn't have said,
hmm
hey, I'm, you know.
hmm
And so having, I think, you know, also partnering with hospitals that have food pantries that offer fresh food, that are able to, you
Right.
know, build up and on what you're doing. That's
Right.
the network that hospitals need to see, because they don't always see the ROI in, you know, giving
Right.
away food, right? Or doing these food insecurity and other financial insecurity types of questionnaires. But it really, it takes a village.
It does. I
Mhm.
know. I think one of the things even that Val and Dean, you know, our navigators do is they'll find, you know, we kind of work nationally, but it's usually over Zoom, right? Or over a recorded line or a, you know, private line, but they will basically find a church in the same zip code or in the neighborhood of the patient that has a food bank or has, you know, so many churches have some sort of food offering once a week or whatever. And so that's often when we don't have money, we try to find them food. You know what I mean? Or try to find them something to help them. But
The
like,
community,
remember
the church
the
itself. I
church,
mean, and
right?
it's
Just to have
like,
the church, right? Send them
you-
to the church, and yeah.
yeah.
It's funny. One time we gave we had a woman. She was 32, 5 kids, and she had stage 3 triple negative, and she was evicted from her house. And I think there were 3 dads involved with the 5 kids. So the dads took all the kids, and she was homeless. And she calls it was like 2 weeks before Christmas. And you know, this is when we first started. We really had no money to give her. And so I started calling around. That's how I met Shanta. And that's how I met Shanta Chambers from Patient Advocate. I called them and said, I have this woman, I don't know you, but can you like help her out? But but Shanta did, but literally I sent her, I cash after some money or whatever. She was staying at a hotel. We got her hotel room. Tell the story wrong. We got her hotel room at this hotel, and then it was next to a diner. And then I called the diner and I said, can you give her 3 meals for like the next 3 days? And I paid the diner. So the next day she went to the diner and she ordered all the food, whatever. I guess I paid them. I don't remember what I paid them, whatever money I paid every day. She ordered all the food. And so the next day I called her and said, how you doing? I said, what'd you eat yesterday? She's like, oh, I ate apple pie and chocolate cake and ice cream and 4 cookies. And like, no, I'm like, what about the chicken or the mashed potato or the broccoli? But that's not what she ordered. You know what I mean? And so I didn't want to like not respect. I'm like, sweetie pie, you're on treatment. You can't eat that stuff. You're gonna have, and the next day she had a horrible stomach ache. And so,
Mm-hmm.
but I called the diner and I said, you need to feed her some chicken noodle soup and give her some some fruit. And like I told the diner what to feed her.
You're amazing. That's awesome.
I mean,
That
like
is
we didn't know what she didn't know what she needed either. Do you know what I mean? And I guess
Right.
she had the opportunity to have food. That's what she picked. But between Shanta and this church that we found, we had her in an apartment by Christmas and she had our kids back.
Wow.
But it was like, I couldn't have done that by myself. I had to call everybody I knew. She was in Memphis. And I think maybe that's when I met Dr. Vidal too. I don't remember, but you guys are doing that for people, which is like amazing. Like I could never do that for any, I mean, that was one incident. We maybe do definitely not 120 a month. So what you're
It's a
providing
gift.
is
It's a
godsend.
gift to do
It's a
the
gift.
work, to have the trust,
It's a gift. It's
to be able to do it.
a gift. It's a gift. So very grateful for that. But people come from, even people who have insurance, who think they have insurance. We've met so many women who think they have insurance until they get cancer. And they've bought the cheapest plan or whatever that their company, or the plan that their company provides, and they have no idea that it's not going to cover an MRI.
Right.
Right.
That's why we have no income. I mean, or to have to produce a W-2 when you've got this chaos going on, and W-2
Right.
does not show
Right.
what will be in
Yeah,
4 weeks. It's just it's unethical. That's literally our view on it. It's just not fair to do to people. Nobody is in a good position when this happens.
Yeah. Can you share a story that you're really proud of?
great
I
question.
could share a recent story. I got a call from a social worker at Mass General in the afternoon, and she said, I put through the application. And so our application process is anything we get now up until the last day of the month goes for the following month. So it wasn't within that cycle. The patient would have typically got it the following month. And she said she has 8 more rounds of radiation and she has no way of getting to the hospital. She lived, let's say, 30 miles from the hospital, and because of treatment, she hasn't been able to drive herself. She was very nauseous. So she was looking for Uber card so that she could take Uber. So we were able to purchase the Uber cards online, and I had the patient call me, and I walked through with her how to add the Uber Cash, I guess it's called, to her Uber account. And I also helped her do her rides for the rest of, this was like a Wednesday, so for the rest of the week.
Wow.
And if we hadn't done that, this woman would not have gone to treatment. There were some obstacles when it came to the Uber, but I stuck with it, even to the point of calling her on Memorial Day to make sure everything was all set. Because
Wow.
that's the dedication that not just me, the any one of us would have done. But I was
Yeah.
so happy because she has children, but one child lives too far, the other child's just not. Some people, I mean, it's hard for me to believe, but some people, their family members, they just can't rely on. and all she had was us. And I actually talked to her yesterday. She called me and she was telling me
Wow.
about, she's done with radiation now, and she was so grateful for what we've done for her. And I talked to her for like an hour because she needed someone to talk to, and I just didn't feel right just hanging up with her. But that brings me joy to know that I did that little bit that I did with for her to go to treatment and finish her treatment that she was having.
That's
That's
so great.
incredible.
It's
Beautiful.
unbelievable. The team is unbelievable. I wanted to tell you that our patients want to give back. They
Yeah.
want to give we get letters and letters and letters, and they say we'll give back one day, we'll give back. They're so sweet. Many come and volunteer. But one thing that patients do that we started like 5 years ago, 6 years ago, for 20 years before that, didn't want to we wanted to be the angel that came and gave, this
Yeah.
sister
Fairy godmothers. Yeah.
and we wanted to, scurry away and not make ourselves known or for patients to feel indebted. But patients really, they want to connect with us. And so we started to optional, it's an optional survey before and after services. So before they get our services, they get a survey just to measure how they're feeling and, what their stress level is. And then we
Right.
send
Right.
this, and then we send a survey at the end of their service time with us, and we measure the same questions. And we have seen over 6 years so consistently, and this is what we presented in San Antonio last year,
Okay.
all the metrics, across all metrics, patient stress goes down. Even for this, what Nikia
Wow.
said, this little bit that I did, which is not a little bit, but those are the
Right.
things, on patients' perceived stress or on their ability to spend time with family, their ability to manage their side effects, their ability to keep their home clean. All these things improve. Their patients' quality of life improve because of this little thing, you know?
This
Um,
little,
so
this little huge thing, right?
yeah, I mean, one day, like what we would love, and you asked about how we raise the money. One day we would love to show that data to insurance companies and say, help us pay for these services that you can keep people
Right.
out of
Out of the
unnecessary.
ER. Out of the ER.
Yeah,
Right.
yeah,
Mm-hmm.
yeah. It helps them. It helps their, and
It's so
reducing
true.
stress is known to improve health.
Yeah.
And
Oh, we know
So.
improving
that.
nutrition as
Yeah.
well. It helps people to stay on treatment longer because when you suffer from malnutrition, what? You're in that hospital for dehydration.
Right.
You're in that
Mm-hmm.
hospital because you don't have enough protein and you got all the
Right.
swelling in your legs,
Right.
building up fluid around you. All these things, right? Like the ripple effect from what you do is so amplified and the impact is so great at that moment for that person in the greatest need.
Yeah.
Like that's the
Yeah.
moment. Yeah.
That's the moment. And I'm sure you have situations where the patients come to you and they really don't know what they need, and just helping them identify how to set their
Yes.
priorities and, who comes first, the chicken or the egg, the kid or the mama or the chemo, and kind of just coaching them through what to do.
Yes.
It's really, really hard. I mean, those are the calls we get too. Like, I don't know what to do first. Should I call the oncologist or should I tell my mother? Or do you know what I mean? Or like even stuff like that in terms of help and talk them off the ledge with their diagnosis. So
Mm-hmm.
yeah, so many things.
Nikia, tell everybody about the symposium that you have
Yeah,
designed and are
yeah,
executing in 2 weeks.
Yes, on June 23rd, this will be our fourth annual patient symposium, and we wanted to focus on patients. So we have a patient panel, two are metastatic patients and two are in remission. And
yeah.
then we have clinical trials talk in which Ricky will be on. She'll be zooming in from Jamaica. She wanted to do it, so she's zooming in from Jamaica to talk a little bit about clinical trials, early detection. We're going to have a beauty session where people will learn
Okay.
how to put eyebrows on when there's no eyebrows there. Skin treatments from burns and whatever from chemotherapy and radiation, nutrition. And the last piece is going to be someone just coming up and talking and empowering our patients who are there and caregivers on volunteering speaking up for yourself, being an
Wow.
advocate for yourself. So I'm so happy to be able to do it. I cannot wait for this program because it's exciting and it's needed. We want to make sure we educate our patients so that they know the right questions to ask doctors. They know when to advocate. And I hear this all the time. I fired my doctor, and you should be able to if you feel like the treatment that you're receiving is not up to par.
I have to, I hate to think people have to feel that way, but yeah, we tell people all the time. They're not all like Mo, fire your doctor, start over again, and let Mo help you find a new one, or let Mo tell you how to talk to your doctor. And
Yes.
That,
ask
at least be able to have a choice, right?
Yeah.
And not be limited,
Yeah.
you can't afford a copay or you can't afford to ride across town,
Right.
and so you're like, well, I guess it's and it's like it's a privilege that everybody doesn't have. So I
Yeah.
think it's so wonderful to talk this person and empower people, but to walk the walk through every day. Right? That really is the model. So how do you influence other folks in other states? Are you having conversations with other groups on sort of how to do this or how
Replicate
to
yourself. Yeah.
grow
Yeah.
that? Exactly. So that maybe there isn't an Ellie fund in Rhode Island, but maybe there's a somebody else fund and someone else is trying to
Yeah.
offer these same things. Like, what advice would you give? That's the question I would ask. What advice would you give to somebody who's, wanting to do this?
Right.
I would say the advice is to listen to the patient because a lot of organizations will just give, 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 like you said, and there's nothing behind it. And it might not be what the patient
What
needs.
they need. Yeah.
So we're listening to patients and seeing what it is that they need, and then we're able to provide that to the patient. So that's the first thing someone should do is listen and understand exactly what a patient needs. I'm not gonna give them money towards childcare if they don't have children. That sounds crazy,
Right.
but that could
Right. Right.
happen.
Yeah. That can happen. Yeah. Yeah. I always say God gave us 2 ears and 1 mouth for a reason.
Yes.
Right? That we don't listen. And I think that's what happens too, that we become prescriptive and just telling patients what they need when they really don't have a minute to sit back. And it may take a minute. You know what I mean? That diagnosis, what it feels like. Everything is ripped under, your house is on fire, basically.
Yes.
The rug is pulled up under you, and you're like, where am I now? Where are my kids? Where are my people? Right?
Mm-hmm.
And like, yeah, I was gonna make some steak for dinner tonight, but do we even have steak? Or like, right? You know what I mean? Like everything. You like, all you hear is that want the doctor's office.
Right.
And you come home to your life and have to tell everybody what's going on with you or not, which we often sometimes don't do as Black women.
Right.
And then, but life goes on with your kids and your husband and your friends, and until you say stop, or I can't do this anymore. So what you're doing is giving people power, which is like,
Yes.
It makes me
I
feel
have
so
control.
good. It makes me feel so good. Just back to the question we were talking about before, like go deep or go wide.
Right,
Um,
right.
that concept of the wah, the chaos. If we're
Right.
there to stabilize people, I mean, one of the biggest issues is delays, right?
Oh
Delays
yeah.
that
How
lead.
long till treatment? Yeah.
Yeah.
Mm-hmm.
Or
And
even just even that first appointment, getting the
yeah.
today.
Right.
You may not see a doctor for 3 weeks.
Exactly. And so and sometimes I mean the social determinants, whatever, they play into that. And so if
Right.
we focus on that moment, that chaotic moment, and stabilize people at that moment, I think it'll change the dynamic for
Yeah.
marginalized people in terms of
Mm-hmm.
getting, early and
Really
consistent
care. Yeah. And how to
treatment.
make decisions. I know. And I think that people getting that my chart diagnosis, I don't want to say it's a good thing because I don't like it at all. But often that brings people to us as advocacy groups so we can help them formulate that list of questions that Mo and I wrote together on what to ask your doctor, or formulate those clinical trial conversations, that so when they go to the doctor, whenever that happens, they're equipped So you guys can get in there and, and have a conversation about, okay, this is what the doctor's going to be talking about. Here's how you help make a shared decision with your doctor about your treatment, and don't worry about dinner that night. It's taken care of in the
Right.
doctor's office. Right. Right.
Absolutely. People fought to get their records advanced to them faster. Like that was a whole thing. Everybody wanted it now, 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 and you get it now and you're freaking out. And it's like, who can help
Yeah.
you? The
Right.
surgeons in the operating room. And I see this every single day. Even my pathology reports say, please know that your doctor may not have seen this report yet and
Yeah.
that someone will call you to review this information with you because the floodgates are open. And knowledge is power, but knowledge is confusing, And so having
Yeah.
advocacy groups and navigators to call and people to call for financial navigation and for those types of resources, it's not just valuable, it's necessary. Yeah.
Yes.
It's
Very.
integral.
It's necessary.
Yeah.
It's
And
necessary.
then
So
another thing
replicate
you were
that.
asking about was when you were saying, replicating ourselves. I mean, for sure, we want to find ourselves. We are talking to health system in Rhode Island now. We that is so on our agenda. And the other thing that I've also learned is stay in your lane, right? It's like it's as far as the what we deliver, stay in your lane and partner, right? We're partnering with Ricky and Touch and, to disseminate information about clinical trials. We're partnering with after breast cancer diagnosis, ABCD, to get peer-to-peer support for our, we don't need to deliver peer-to-peer support because they do a magnificent job. We just have to make sure we refer every single patient.
Every
That
single
if we're getting 120 a month, every one of them has to know about, Ellen's little organization in Minneapolis that is serving,
Yeah.
patients around the country for peer-to-peer support. So stay in your lane and lock arms has been something that we're really focused on too.
Mm-hmm.
I love that because when you're singularly focused that way, you don't dilute your mission, And so, while it is, important to think about how do you scale, but knowing where your scale is and what your range
Right.
is so
Right.
important.
What your capacity is too,
Exactly.
Mm-hmm.
Yes, because
Yeah.
our bleeding hearts will have us,
Right.
right,
Give it all. Yeah.
out of cash,
Yeah.
out of a house, out of a
Here, come
building, out
stay
of
in
a,
my house. I'll feed you. What do you come on over? Have a
it's
place.
so.
Yes.
I
Yeah.
got a question. Does the Ellie family know, are they still, are they abreast of what is happening and what has blossomed out of this one life and this one story?
Yes. Yes. Jeff Pumpkin is on our board. And he is very involved with the Ellie Fund behind the scenes. He allows us to, do what we do best, and he recognizes that. And he was in the office about a month ago, and we sat with him and actually heard the story. We knew some bits, but he kind of filled in those gaps. So he is very involved. His daughters are involved. They do fundraising for the Ellie Fund. So it's great that he's still involved, and because he's the reason why we're doing what we're doing.
And he has an Ellie. His oldest daughter is Ellie.
Oh, that's great. That's so
Yeah.
great. So you
Yeah.
guys, I know what you can do for us because I'm gonna be calling you, send you patients. But what
Please.
can we do for you?
You're doing it. I mean,
Yes.
you're making connections. You are showing up when it's not that convenient for you to talk to our patients about clinical trials. I mean, when I say, Ricky, you're writing, questions to ask your doctor, we need to have that for our patients. And like
Yes.
you do so much. I don't even know if you're aware, but we'll think bigger if we must.
Let's figure out how we can partner more and let's figure out how we can scale this so every city has it. You know what I mean?
Yes.
And I think we should talk to Shanta. Do you know Shanta Chambers about this? I'm gonna reach out to her.
I looked her up and we're LinkedIn buddies, but I haven't
Okay.
had a real
She's a jewel,
relationship
and
with her.
she's, they're giving stuff all over the country, and they have a program that's kind of by zip code. So I'm not exactly sure how it works, but I think we should figure out how to blow this up.
Totally.
Yes.
Blow
Oh
it
my
up.
God, love it.
Let's blow
I'm
it
in.
up. There shouldn't be any limits. There shouldn't be limits by where you get sick. you know, and we know, I just met with a bunch of organizations in the DC area, and you know, we have horrible numbers here, especially for triple negative breast cancer. It shouldn't be that. It's where you live, should
Right.
dictate what kind of care you get and
Yeah.
what kind of services you have. It's your fingertips. It should be everywhere with this disease. So we have much work to do.
We do.
Thank
Yep.
you
And
for,
we're ready to do it.
yeah,
I
totally.
know, feel it. So how do people reach you, like if they need something? And I haven't
So
been-
our website is elliefund.org, and that's ELLIEFUND.org. My email address, they can reach out to me personally, is Nakia, N as in Nancy, EKIA at elliefund.org. And I don't mind phone calls as well. So people, if they want to call me, my cell phone is 774
You're gonna regret that. Say it again. I'm not gonna put it in the
That's
chat.
what I'm here for. Yeah, but I'll still give it out. 240-8013.
So go easy on her, folks.
Mhm.
She's
Yeah,
generous.
they didn't get it.
Text too.
Yeah.
Okay, I was really lame on comments today. Sorry. Let me just make sure anybody in the chat hasn't been talking. Lots of people are talking. Sorry, guys.
I got some of it. I don't think I got all of it though.
Yeah, okay. I wasn't really doing a good job today, you guys, but everybody's asking about mental health and healthcare for all. And thanks for these comments, you guys. So I'm gonna put theelliefund.org, right?
Just
Mhm.
elliefund.org.
Just Ellie,
Mhm.
know the.
Okay, elliefund.org, and you can always come through us to find information. And you guys are in Boston, and
Serving anyone coming to mass, anyone in mass or coming to mass, and we will be bigger soon.
we will.
With the help of Ricky.
We'll make
Dr.
that happen. We'll find some stuff, you know, let's pick some
Yeah.
cities and go find some friends.
DC.
Yes.
DC would
I
be
see
great.
Coach
Yeah.
Melody is lighting it up in the chats, and it's why we need this sort of the cultural humility
Yeah, yeah,
and cultural competence. And I think that,
yeah.
this program, this organization, and the mission that it stands for and the work doing, it speaks for itself in your efforts to really not only reach breast cancer patients, but reach them, from every walk of life and through the health equity. And that's really what it needs and what it takes, right? It's not we focus on
Yeah.
it during the month of February, but it's like baked in. How can we do better, making things accessible, making them, in greater equality, right? Right. Health equity is, I mean, Ricky, you like to say, that there's health inequity, right? But this is an
Yeah,
example of
health
trying to
equity.
balance those things.
This is,
Yeah.
well, this is my golden rule. Treat others as you want to be treated.
You
If we
bet.
all did that, we'd have a different healthcare system, but that's what you guys are doing. You're thinking about, gosh, if this were my mama, my daughter, or me,
Mhm.
or my family, what would they
Right.
need? How could I
That's
serve?
Right.
Right. So thank you for that.
Yes, yes, yes. We hope it's been relatable and reliable and real. So we do every Wednesday night here at 6 p.m. on blackdoctor.org, 6 p.m. Eastern. And we're
Yeah.
so grateful for the platform, for the
Yeah.
sponsors, for our guests, for our blessees who watch, people in
Yeah.
the chat. Just gratitude, right, Ricky?
Yeah. And share this, especially if you know anybody in Boston, I mean, and you know what? We don't want to wait till people get sick. People should know
Right.
before they get sick.
Right.
That's why we're sharing all our information with gynaes and GPs and pediatricians, because they need to know us before we need it. So
Exactly right.
Yeah.
blessed love.
See you next week.
Blessed love. Thank you.
Doctors in.
See you next week. Love you, Mom.
Bye. Love you
Bye.
all.
Bye.
Bye.
Bye.